Thank you, Madam Vice Chair and members. SB 562 will establish a state-based universal healthcare system to provide comprehensive healthcare coverage to every Californian. I want to take a second to acknowledge a friend of mine that is visiting. He's a member from Sydney, Australia, who's in town today, and understand that our president really cares for the Australian universal healthcare system. I couldn't help but I didn't mean to politicize your visit, Alex, I'm sorry. But I just couldn't help but talking about that occurrence. But our current healthcare spending is approximately $350 billion a year. That is 14% of our state's total gross domestic product. Healthcare spending is growing faster than the overall economy, and by 2025 will be 20% of the national GDP. At the same time, Americans pay more than any other industrialized nation for healthcare, almost $10,000 per person. Yet we do not have better health outcomes, and we cover fewer people. Given this picture of increasing cost, healthcare inefficiencies, and the uncertainty created by Congress, it is critical that California chart our own path. According to the committee analysis, the state will need to increase spending in order to extend coverage to all Californians and improve the coverage for millions who are uninsured and whose high deductible and copays limit and prevent them from accessing care. But we will also find greater efficiency that comes from a publicly run plan and increase the health care of all Californians. We currently have a financing study underway by researchers at the University of Massachusetts at Amherst. The study will identify potential funding sources and savings that would allow California to reach a universal coverage. I will work with stakeholders to refine our proposal and amend the financing into this bill. The bill proposes to clamp down on healthcare costs in several ways. First, doctors and hospitals will no longer need to negotiate rates and deal with insurance companies to seek reimbursement. Second, by pooling healthcare funds in a publicly run fund, we get the bargaining power of the 7th largest economy in the world. Third, all Californians will have access to full scope care and preventative services. This will allow people to get the care they need before they end up in a more costly emergency room. SB 562 will finally enable California to cover all of its residents and create a healthier and stronger state. I look forward to having a robust discussion around the financing of SB 562 when the finance study is done, and commit to bring the bill back if need be, to ensure that we continue to have that discussion in this committee. I will share the report with all committee members and make it public once it is complete. With that, I respectfully ask for your aye vote.